morning, everyone. Again, we welcome our fellow doctors, mental health advocates and guests, special guests, HMO partners, congratulatory greeters, Life Balance and Resiliency Center team from VRP Medical Center. Welcome. We also like to welcome also to those who are joining us via online and FB Live. Okay?
Yes, some of us are joining us via Zoom. We're also on live on VRP FB page, and later we will upload this event to VRP's YouTube channel. This program will be available on demand when you tune into the VRP Medical Center FB page and YouTube channel.
So for the launching program today has two parts. The first part is the facility blessing and facility tour that we just had at the 7th floor. We'll be showing you on the screen the video and the photos of what happened earlier during the facility blessings and ribbon cutting at the center on the 7th floor. Okay? So let's watch first what happened earlier.
For God's blessing on all those who are and will be here, or who devote and will devote themselves to caring for the sick. And let us ask the divine blessing on this place, Life Balance and Resiliency Center, erected for the care of the sick. When he sent forth his disciples to preach the gospel, he commanded them to visit and heal the sick. Grant that in this hospital the physicians and staff will receive with kindness all the patients who are and will be here, will tend to them with skill and care, so that those who come here sick will leave restored in spirit and in body, and forever praise your mercy. We ask this through Christ our Lord. Amen. Let us water call to mind our baptism into Christ, who by his death and resurrection has redeemed us. God bless you first.
We'll also distribute lunch boxes for each guest, which you can take out and eat later to keep up with our safety protocols.
But wait, there's more. Our special guest will also receive a welcome guest kit and a limited edition of LBRC stress ball. So this stress ball could also help us when we are anxious or when we feel anxious in a particular situation. So whenever we feel anxious, we usually
kailangan na.
So that's why I demonstrate how to use it with our hands. So when we use the stress ball, it will help us calm down and reduce our anxiety during that particular moment.
So additional announcements also, before entering this room, you probably notice our photo wall outside. So it's open to all, and we would like to invite you there to have our photo ops later.
So be there. So this is the limited edition stress ball. So usually when we have this in our bag or in our pocket, this would help us release our stress whenever we feel, like I said earlier, when we feel anxious or when we feel stressed in a particular situation there.
Yes, so this is not only used to stroke patients, but also to relieve anxiety. Now that we have all settled down, I think we can formally start the program. We would like to officially mark the opening of this part of the event with remarkable opening remarks from our Medical Director, Dr. Edgardo Penserga.
Thank you, and good morning, everyone. Our honored guests, welcome to this opening and blessing of our Life Balance and Resiliency Center. This is a very good initiative, and I would like to again thank those who have been very, giving everything that they have to have this realized. This is a very important aspect of healthcare, especially during these times of difficulties. So this is very timely, and I hope that this will be a very successful, service that we will have. So welcome everyone, and thank you. Good morning.
Thank you very much, Dr. Penserga, for your opening remarks. Now, to give us a warm welcome remarks with the advocacy and overview of the Life Balance and Resiliency Center as another milestone for VRPMC, let us hear from the President of Victor R. Potenciano Medical Center, our dear Mrs. Maria Victoria Vergel de Dios.
Hi, magandang umaga po sa inyo lahat. I'd like to specially acknowledge the presence of our special dignitaries and guests. Of course, I'd like to welcome Mr. Rhais Gamboa, who is a director of the hospital and COO of Mount Grace Hospital. We have with us also today our City Health Officer, Dr. Arnold Abalos. Salamat po sa pagdating. We have Dr. Julien Guiang, who is the head of our LBRC, Life Balance Resiliency Center. Okay, and then we have Dr. Raul Gardaya, who is also a part of the team. We have Mr. Dondi de los Santos, who is a cluster head of Mount Grace and is in charge of overseeing VRP Medical Center, okay, being part of Mount Grace. Ms. Golda Go, who is the marketing head of Mount Grace. We have Dr. Renee Abad, chairman of the Department of OBGYN. Of course, we have Dr. Portia Luzpo, and of course our MCs. Thank you for being our MC today. On behalf of the VRPMC board, I welcome you all as we officially launch the new addition to our hospital services, the Life Balance and Resiliency Center. Ang ganda ng pangalan, ano? So today is another milestone as we share the same mission as the growing number of mental health advocates in the country. We are making life balance and resiliency part of the mainstream solutions for physical, emotional, and mental challenges that most people encounter, especially during this unrelenting COVID pandemic. Together with our able and seasoned adult and geriatric psychiatrists, neurologists, psychologists, and center advisors with our nursing services and backroom support teams, we are ready to serve and address the increasing demand for mental health services of our patients. Our hospital mission of Alagang VRP is our badge of commitment to provide the needed interventions for patients with psychological and emotional distress, depression, anxiety, post-traumatic stress, work-related stress, geriatric health issues, and others. I am very confident that we can provide an excellent patient experience for psychiatric, neurological, and psychological assessment, administration, intervention, and even preventive care for our patients. With that, I welcome our guests to our new Life Balance and Resiliency Center, or the LBRC. And I would like to congratulate the LBRC team, headed by, of course, Dr. Ning Lopez, who successfully prepared for this launch, and in advance for sustaining this high calling of Alagang VRP. So once again, I welcome you all and congratulations to everyone. God bless.
Thank you very much, Ma'am Birma, for your heartfelt welcoming remarks to our guests. So we are very grateful to our guests joining us today, and we are honored to hear from some of you. So at this point, it is our honor to hear a congratulatory message from the Medical Chief of the National Center of Mental Health. He cannot join us face-to-face today, but we graciously recorded his message for us. So ladies and gentlemen, here's a message from Dr. Noel Reyes, the Medical Chief of NCMH.
Dr. Edgardo Penserga, Medical Director, Mrs. Vergel de Dios, President, Dr. Mariano Lopez, Deputy Medical Director, and Dr. Julien Guiang, MHS Team Leader, and all the management and members of the VRP Medical Center. My warmest congratulations on the launching of your new facility, the Life Balance and Resiliency Center, an important and timely program that our service users can benefit from, given our present predicament and public health status. We at the National Center for Mental Health is likewise at the crossroads of transformation, from symptom-based treatment facility to evidence-based and recovery-oriented care, enhancing the preventive and promotive aspect of mental health through the establishment of networks of care and multi-level linkages. NCMH is looking forward to have an ally and partner in providing diverse mental health services for individuals needing competent psychiatric, neurologic, and psychological care. Wishing you all the best. Again, congratulations, VRP.
Thank you, Dr. Reyes, for that video message. So, the National Center for Mental Health looks forward to VRPMC, like Balance and Resiliency Center, as its ally in providing psychiatric, neurological, and psychological services to all its patients. Okay. Next one will be having another video message from Dr. Antonio Sison, the President of the Philippine Psychiatric Association.
Good morning, this is Dr. Tofi Sison. It is my privilege to congratulate the VRP Medical Center for the newly constructed Life Balance and Resiliency Center, which is designed to promote mental well-being and wellness. This is certainly much needed as we gradually recover from the pandemic. I'd like to send my personal congratulations to my dear colleagues, Dr. Julien Guiang and Dr. Raul Cardaya, for this pioneering and wonderful venture. I also would like to congratulate the rest of the team, composed of Dr. Maurice Sanosa, Dr. Oliver Ko, and Marian Jasmine Lopez, who bring with them a wealth of clinical experience. Wishing you all success for the VRP Life Balance and Resiliency Center. Congratulations.
Thank you very much, Dr. Sison, for your message. So we know that VRP Medical Center is an active member of the hospital network of Mount Grace Hospital Incorporated. It will not be complete if we don't hear a special congratulatory message from one of its MGHI officers. We would like to call in the COO of MGHI and a member of the Board Directors of the VRP Medical Center, Mr. Rhais Gamboa.
Maraming salamat, Doc, at magandang umaga po sa inyong lahat. Dr. Abalos, our President, Mrs. Vergel de Dios, and all the guests. You know, as I was standing kaninang umaga waiting for the ceremonies to begin, it just dawned on me and I peeped in the room. Parang I was expecting equipment, but actually, walang equipment to all rooms. But it dawned on me that the art of healing, the science of healing, is not all about equipment. But a major component of healing, of course, has to do with the psyche. And the doctors here would know that, and I had my short consultation earlier also. And when the blessing was on, parang it dawned on me that I understand from Rona here that by next year, we will be celebrating our 50th year. For any institution to reach 50 years means that institution finds relevance in the community that it serves. So relevance is a key word, because if VRP is not seen or perceived as relevant by the community that it serves, it will not be sustainable. And the fact that the team at VRP was able to come up with this special project, with this special service, means that they have their eyes keen on the ground. They are reading the requirements of their target market. They're reading the requirements of their patients. And as far as I know, this is the first time in our network of 20 hospitals that we are formally inaugurating a service as focused as this. So relevance is something that has characterized VRP and continues to guide it as it moves forward. So the second point I wanted to make also is that, again, I was chatting with someone kanina, VRP is located in a situation where you have a lot of the bigger hospitals. VRP cannot be everything to everyone. But VRP has chosen to focus on specific service niches that allows it to survive and to compete. And this kind of service is a niche that I would say will allow VRP to characterize itself as very focused in certain areas. And I think the third insight that I got this morning, Dr. Penserga was Dr. Ning or Dr. Penserga was telling me that by next month, we shall be inaugurating our cath lab. This again is an indication of the commitment of the VRP team to continuously improve itself, to continue to provide relevant services to the community that it serves. It will focus on certain subspecialties, but it will do that and do it well. And from the roster of consultants that I saw, you can see that this center has put together the kind of specialists that can provide the excellent care that the community expects and that the community deserves. So on behalf of Mount Grace and on behalf of the VRP board, if I may add to what Mrs. Vergel de Dios said, I would like to congratulate everyone involved in this project, and I would like to congratulate the VRP team for its continuous efforts to keep this institution relevant. Maraming salamat. Magandang umaga.
Okay, thank you very much, Dr. Gamboa, for your message. So, I'd like to thank you for our dear guests for their special and inspiring words for VRPMC and the LBRC team. So, this, as he said earlier, Dr. Gamboa said earlier, the relevance of this initiative for the community that it serves is very important. Okay? So we have more greeters who would like to be part of this historical milestone of VRPMC, and we would like to play their videos on screen. Okay, so may I please play it now? Thank you.
Good morning. This is Dr. Shelly De La Vega, Director of the Institute on Aging, NIH, UP Manila, and past President of the Philippine College of Geriatric Medicine. I would like to congratulate the VRP Medical Center for the launch of your Life Balance and Resiliency Center, especially to congratulate the President of the VRP Medical Center, Mrs. Vergel de Dios, and the team of psychiatrists, geriatric psychiatrists, psychologists, geriatricians, including Dr. Maurice Sanyosa or Bong Sanyosa, and of course, Dr. Sandy Dumlao, and all the team members who are going to provide inpatient and outpatient clinical practice services. As you know, the Institute on Aging has been involved in many researches in the community, including health systems research and health assessment researches, which includes evaluation of memory and mood disorders. In one of our recent researches, the Fit for Frail, we realized that there is not enough medical and mental health practitioners all over the country. Of our participants, for example, 0.3% knew that they were diagnosed with depression, but when our geriatricians did a comprehensive geriatric assessment, close to 19.8% of them actually had diagnosed depression. And although none of our participants reported that they had depression and dementia, close to 9.2% were actually diagnosed to have dementia when they did the geriatric assessment. Furthermore, the Institute on Aging has been involved in the periodic health exam, mental health guidelines, for which we are recommending to the Department of Health to do screening of asymptomatic adults, especially screening for addiction, screening for anxiety disorders, screening for sleep disorders and stress. So we look forward to working with the VRP Medical Center on your new program, especially if you need us for research and program evaluation. So I'm sure that your program is going to benefit the community and the Filipino older person especially. Congratulations and thank you very much for inviting me to give this greeting.
Okay, so we are grateful to hear encouraging words and congratulatory messages from our dear doctors and mental health advocates today.
Yes, Dr. Ko, we couldn't ask for more. So we are so privileged for their generous support to Life Balance and Resiliency Center. With that, we know that our lead doctor for the LBRC would like to respond with a message of commitment to carry out the vision and higher calling for which the LBRC was designed. So let us now hear from Dr. Julien Guiang to represent the MH team of VRPMC's Life Balance and Resiliency Center.
Pleasant good morning to everyone. On behalf of the LBRC team, which is headed by yours truly, our Muse and advisor, Dr. Portia Luspo, Muse, our neuropsychiatrist, Dr. Raul Verdaya, our geriatrician, Dr. Sanyosa, who is not around since he'll be flying to Davao today. Dr. Ko, Dr. Marianne Jasmine, our psychologist, and most especially to our visionary, Dr. Ning Lopez. Siya yung siya yung nag-ano dito sa atin. Particularly the name of LBRC, siya yung nag-coin. And Madel, our Mabel, our nurse and also psychiatric nurse, Rose. We would like to thank Ma'am Verna, Ma'am Rona, Dr. Lopez, Dr. Penserga, for giving our team the opportunity to spread the importance of mental illness, particularly in this time of pandemic. Mental health is a journey, not a destination. Dr. Lopez's vision of making the VRP LBRC a reference center for the community, as well as different private hospitals, will be on the path of realization. The launching of LBRC is timely as we celebrate the World Mental Health Month, the theme of which is make mental health and well-being for all a global priority. By launching LBRC, the VRP raises awareness about mental health, thus decreasing the stigma attached to it, educating the public about the warning signs of mental illness. Issues can help people safe. Increasing the awareness around mental health issues also helps those who suffer from this feel less alone. And finally, mental health is the foundation of a happy life. Thank you.
Thank you, Dr. Guiang, for your wonderful message. So indeed, this is a very good start again for our VRPMC. So to wrap up this historical event of our of VRP, we would like to hear final words with the overall vision and mission of LBRC and what makes this center unique and one of its kind. So without further ado, may we call in the Deputy Director of the VRP Medical Center and the thought leader of LBRC, Dr. Mariano Lopez.
Well, good morning, colleagues in VRP and our special guest. Well, the COVID pandemic has been with us in our personal lives and in the community for the past 2 years or so. It has caused so many deaths and disability among us Filipinos and affected our day-to-day living with fear, anxiety, depression, and other psychological difficulties in coping up on its presence within our homes and our workplace. I, for one, and my family had been affected by the COVID pandemic, and we were patients in this hospital for almost three times already. And without strong mental fortitude, you could probably break up and probably say, it's our time in this world. But these mental challenges are part of our life and that people must deal with for many years to come. I think COVID pandemic will be here for a long time. And after the COVID pandemic, probably the severe economic depression probably that we will have, if ever the global problems that we have, especially the Russia-Ukraine war and everything, will go into serious consequences. I think the people should be right now more aware that mental health is as good, as more as important as physical well-being. That's why the Life Balance and Resiliency Center is but a welcome and timely response on that perceived need for a place for those mentally challenged to seek expert consult and treatment. Actually, when we started with this mental health, actually it started with a meeting that our MANCOM would like to to have a clinic that will answer the mental health needs of our patients. Okay, there was a need, and it seems that we could just have a mental health clinic here in VRP. But you know, when you say mental, it has a stigma that you are out of your mind. Okay, well, sorry to say, na pang NCMH ka, o mental hospital. Ang feeling ko na if you are not really in practice, especially in medicine, there are so many people who's really what I call mentally challenged because of the problems in life. You know, sometimes they cannot work well, they're very good in life, but because of their many problems, stresses in family, in business, in money matters, they cannot succeed. And I think, so we thought probably yung mental health clinic is not enough to answer that need. So we came up with what you call and also we realized that seniors, well, like some of us here, like myself, sometimes realize that you are not as good when you were young. In my 30s, I can tell you I could beat anybody in academics and even in strategies. But you know, when you get old, you will realize that your time is coming to probably into, that's already blossomed and going down already. And you feel that now that I realize the importance of geriatrics, because I feel that the senior people are the ones most challenged, okay, in terms of in life, and most of these challenges are actually mental, and we feel, and these challenges are what they call, like, there's so many seniors who have memory loss, has what you call this depression, anxiety, fear of death, fear of disease, and sometimes, you know, if you really are, so I think that if you look at mental problems, it's a spectrum. Okay, one spectrum is really the one who really ends up in the wards in mental center for mental health, but the other spectrum are those in your homes, who has a problematic life, almost has so many fears that they cannot work well. So we thought probably that clinic called Life Balance and Resiliency Center is aptly what you call this, adapted to the needs of the people. Because if you are mentally healthy, you are what you call this, you have resilience to really what you call this, live in this life. So resiliency is very important if you have mental wellness. So I'm very happy that the administration has supported this concept during all of our meetings. Thanks to our president, Ma'am Vilma, and our hospital administration, Ma'am Rona, and to all of the team that set up this clinic, especially my colleague and doctor, not colleague, but my psychiatrist, my favorite psychiatrist, Dr. Portia Luspo. We are of the same age kasi. So I'm happy na we know our problems then. Then we have Dr. Julien Guiang, Dr. Raul Sanosa, Maurice Garcia, then Maurice Sanosa, and we also include the neurologist, Dr. Christian Ko, because not all mental problems are functional. Some of them are organic, like Alzheimer's, like senile dementia, which I think could be treated well by a neurologist. And definitely it's very important that we have a psychologist, because they have an expertise that they could offer more than what the medical experts can give. So I tag along my daughter, Dr. Ma'am Marian Jasmine Lopez, to be part of the team. So I'm happy that we have this team, and in this regard, at least our work have been done, but the real challenge is yet to come. And I hope our community will appreciate this Life Balance Resiliency Center for many years to come. And we think that it's really relevant for all of these patients. So may I thank our special guests for their presence in the launching of our Life Balance and Resiliency Center today, which give us the importance of this clinic. The Philippine Psychiatric Association President, Dr. Antonio Sison, and the National Center for Mental Health Director, Dr. Noah Reyes, in video. Also, Dr. Sherry De Vega, I think the President of the Geriatric Society, also in video. Our Mount Grace Hospital Incorporated executives, Mr. Rhais Gamboa and Mr. Don Didros Santos. VRP management, represented here by our President, Mrs. Vergel de Dios, Hospital Administrator, Ms. Veronica Garcia, Medical Director Edgardo Penserga, and the VRP community fervently hope that the LBRC will truly be relevant to the life balance and resiliency needs of the community we are to serve. So thanks again, and God bless.
So thank you and congratulations again, Dr. Mariano Lopez, for being the father of the VRP Life Balance and Resiliency Center. So we are all indeed looking forward to help more patients in the future. And before we end this program, we would like to show everyone some of the congratulatory messages sent by other VRP heads.
From the Department of Physical Medicine and Rehabilitation, I would like to congratulate the people behind the creation of Life Balance and Resiliency Center. Mabuhay kayong lahat.
On behalf of the Department of Obstetrics and Gynecology, I would like to congratulate the people behind the Life Balance and Resiliency Center of the Victor R. Potenciano Medical Center. The likelihood that some of us will suffer mental health symptoms after a stressful period of time, just like what happened or is happening to some of us during this pandemic, is influenced by a number of factors. And this center will surely provide a holistic approach to a person's emotional, psychological, and social well-being to cope with whatever mental health illness we face during the different stages of our lives. True to VRPMC's promise that dito sa VRPMC, safe at alaga ka namin. Cheers to the launching of our new center. Wishing you all the best.
In behalf of the Department of Surgery, I want to congratulate our hospital, VRP Medical Center, for the new service that is offered, the Life Balance and Resiliency Center. This is very important, and it will help a lot for our patients, especially during the pandemic. Congratulations again.
Good day. I am Dr. Presidiano V. Zamora Jr. On behalf of the VRPMC Department of Internal Medicine, I would like to congratulate the administration, the Office of the Deputy Medical Director led by Dr. Mariano Lopez, and the project leader, Dr. Julien Guiang, for launching this Life Balance and Resiliency Center. This is indeed a very relevant endeavor. As such, for the longest time, mental health issues have often gone unrecognized and untreated. Addressing mental health issues is an integral part in the holistic management of patients. Healing should not only be focused on the body, but should also include the mind as well. Our department sincerely appreciates this offering of this new service, and we shall be in full support of this project. We are one with you in improving our approach to mental health issues and at the same time eliminate the stigma associated with these conditions. Again, congratulations.
Okay, to wrap up this historical event of VRP, we would like to inform our guests that the welcome guest kit contains the primer about LBRC, including the service offering list and credentials of the doctors, with some pictures of the center. For more information about Life Balance and Resiliency Center, you can call VRPMC trunk lines 84649999, local 335, or send an FB message to VRP FB page or IG account, or visit the website vrp.com.ph. So may we invite everyone to please go on stage, go out the stage to have a picture taking.